Hi, everyone. Thank you for joining us today. I am Cassidy Avila with the Center for Optimizing Rural Health, also known as SORH, and I'm pleased to welcome you to this webinar on getting the most out of your State Office of Rural Health Partnership. Today, we have two speakers from the National Organization of State Offices of Rural Health joining us to present this webinar. But before I introduce them, just a couple of quick housekeeping items. We are recording the webinar and we will share a link to this recording as well as a copy of the slides with you in a follow-up email. So give us about 24 hours to get it posted and you should receive an email from SORH. There will also be time for Q&A at the end of the presentation, but feel free to drop your questions in the chat box during the presentation and I'll make sure that they are addressed during the Q&A time. So it is now my pleasure to introduce our speakers. Ms. Tawny McCoy is the Technical Assistance Director at the National Organization of State Offices of Rural Health. Tawny joined NOSOR in October 2021 after nearly 6 years with the Idaho Bureau of Rural Health and Primary Care. And while serving the Idaho SORH, she collected and analyzed all of the provider data for the shortage designations, managed an average of 80 to 90 subgrants across 3 state and federal funded programs annually, and managed the SORH grant. Holding technical expertise in rural health clinic program compliance, Lean Six Sigma, and empirical research, Tawny uses her knowledge and experience to help the 50 state offices of rural health in the nation develop rural programming expertise. Also on the call and presenting today is Caroline Mazinski. She's the Education Manager at the National Organization of State Offices of Rural Health. And Caroline helps NOSOR streamline and build upon their educational, engagement, and evaluation strategies and coordinate with partners and stakeholders, new and old, to enhance and support SORH capacity building efforts. Caroline joins NOSOR from the Kansas Primary Care and Rural Health Office, where she was the Flex and Ship Coordinator for 92 critical access hospitals and maintained the SORH, PCO, and SLRP grants, along with other rural health programs for Kansas. Caroline previously served as the Training and Special Programs Coordinator for the Kansas Governor's Grants Program, where she coordinated with the Kansas Academy for Victim Assistance and the annual Crime Victims' Rights Conference while monitoring the State Victims of Crime Act targeted technical assistance and improving criminal justice response grants. So I think we are in very knowledgeable and good hands, and I will turn it over to you, ladies. It is all yours. Thanks for being here.
Thank you so much, Cassidy. So I am Tawny. Thank you so much to Cassidy and SORH for asking us to come and provide an overview of who we are and what we do, as well as the state offices of rural health. So NOSOR, for short, is a membership organization, and our members are the 50 state offices of rural health. What makes us unique is the majority of our hands-on programmatic staff, like myself and Caroline, we have formerly worked in state offices, and we call them SORH. Our objectives are on this, or will be on a slide soon. And we accomplish those by getting down in the weeds with the state offices. And that is a large part of what I do every day. We also get to be the voice of SORH on Capitol Hill, as well as being the conduit from the federal level down to the states. Here is, if I can get my mouse to work. Here is me and just a little snapshot of kind of my history, summarize what Cassidy just said. Here are our members. So as I said earlier, all 50 states have a state office of rural health, and once a year we come together and we get to have the opportunity to hear from industry experts. We also get to share projects that we're working on, best of practices, and get to hear what we are working on individually in our own states. Because once you see one SORH, you're only seeing one. As the Technical Assistance Director, I can absolutely attest that every SORH is doing their own thing. And the beauty of that is they are empowered with their federal grant to be able to meet the individual needs of their states. And so even though it is a federal grant that goes down to each of the states, they have the option to be able to say, this is what is going on in our rural communities, and this is what we need to do to address whatever issues there are. And so when you hear us, Caroline and myself, speak today, please know that we are going to be speaking as an overview. But if you want to hear more about specifically what is going on in your state, we highly encourage you to get a hold of your individual state office. On the slide here, this link at the bottom, you can go to our website and find your individual state member, their contact information, also a roster of their employees. And so, like Caroline and myself, having a history of working in state offices, there's the State Office of Rural Health Grant, which is kind of the home grant of the office. And then there's other programs that are rural related that are also worked on in that office. Here are our 3 core functions as SORH: information dissemination, rural health coordination, and technical assistance. So each SORH, again, is federally funded to provide these core functions, and they are, however they look in their individual state is completely different. And again, I highly recommend that you get to know your state office of rural health and find their contact on our website below. Now, one of the great things, and just one, there's many great things about state offices of rural health, is that they are natural conveners. They are a neutral point in the state whose only agenda is rural focused, rural and underserved. Being able to know all the activities that are going on that are rural and underserved related in the state is a pretty hard task, but that is one of the things that they are great at. They work to coordinate, be able to have that network of rural and underserved individuals and organizations. And one of the great things that they do is they reduce duplication, because when you are in the know, you're able to know when somebody in the north of the state is working on the same activity as somebody who is in the south of the state. And instead of them working in silos, the SORH is that central point that they can say, hey, this is something that we're working on. If you know of anybody else that is doing something similar, could you please connect us? So being that neutral and natural convener is very important, and what SORH are really great at. SORH are the ones that definitely make that effort to know who all is doing what in the state. They are the ones that have that ear to the ground. And even if they hear someone is working on XYZ project, even if it's not the exact same, if they think through their experience, there is a potential connection there, they can definitely help build that bridge to get that network connected. And they bring organizations together. They're able to coordinate and really help the rural partners network with each other, but also build that sense of camaraderie. So especially in rural and underserved, it's not very competitive. We're more collegial, and we want to really help rural and underserved as best as possible. So we work together. We don't really work against each other. Now, please remember, everything that a SORH does is work to improve access to healthcare in rural and underserved areas. And so, again, with all SORH being different, they have different priorities. And just some examples of the work that they do are here on the screen, and I'll give some more detail on each. So with education, they provide educational webinars to rural health clinics, critical access hospitals, small rural hospitals, federally qualified health centers, as well as your regular non-affiliated outpatient primary care offices. And the type of education that they provide are anything and everything when it comes to CMS regulations, payer information, any sort of CDC guidance or best of practices. Most of the SORH also offer in-person conferences, or they partner with other organizations to bring those in-person conferences where they bring together the stakeholders from all the different rural healthcare facilities, so they can be that natural convener of bringing all of them together to be able to network, swap stories, swap ideas, get the most up-to-date information and best of practices. Also, some SORH offers scholarships. Scholarships to travel to out-of-state conferences. For example, in Idaho, we, when I was previously working for them, we provided scholarships to rural health clinic managers to attend the National Association of Rural Health Clinics conference. They have a spring and a fall. They call them institutes. As part of that, we provided a reimbursement scholarship for them to work toward their certification as a rural health clinic professional. Especially in rural, it is normal for them to be working on a shoestring budget, and it's really hard for them to pull dollars away from something that's very important on the clinical side to be able to really provide that professional development and expansion for their non-clinical staff. And so anything and everything that a SORH can do to help bridge that gap, that's something that they will consider. And I highly recommend that even if your SORH doesn't currently offer any scholarships, that you ask them if that's something that is going to be an option in the future. Establishing that relationship and really having a more of a collegial relationship with your state office of rural health. If they don't know that you have a need, they can't address it. And so the more you can communicate with them, we highly recommend, because if they can see that there is a need out there that they have the ability to address, there's an option to fill that gap. So highly recommend. Also, another example of a work is workforce. So an example of this is resident events. Some SORH establish relationships with medical resident programs, as well as rural facilities that would like to establish rural rotations or even have long-standing open positions that they are looking to get filled. And so they will coordinate and establish an event where one evening they invite community organizations that are looking to establish either that rotation or have an opportunity available with resident programs, to have the residents bring their families, their spouse, their partner, any children, and bring them together for like hors d'oeuvres and just have a very casual meet and greet where they can kind of do the groundwork and the footwork to be able to establish those relationships, see if there's a match there, see if they are interested in going to a very remote area of the state, or somewhere that's just on the outskirts of an urban area to complete a rural rotation, or if they're looking for a really good community to land in after they graduate, and they want to make sure that the school system is good, see if there is an option for their partner to get a job as well. This is a really good kind of matchmaking event for them. Also, hopefully no one's a stranger to 3RNet. 3RNet is the Rural Recruitment and Retention Network. It is a free job board for rural specific job opportunities for healthcare. And so it is nationwide. There is most SORH are the holders of the managers of each state subscription to 3RNet, and they are the ones that allow organizations to sign up. They do a pretty good job at gatekeeping to make sure that urban facilities don't get on there and kind of hog all the the potential workers. And so it is rule specific, and so it's the only one in the nation that is rule specific. So I highly recommend that y'all check out 3rnet.org to see your state's specific information and see what type of jobs are currently on there and how many potential employees are signed up to receive information about specific job types, if that is something that you are looking for. Now I will go ahead and hand it over to my esteemed colleague, Caroline Rosinski. Thank you so much.
Thanks, Tani. And then just kind of like Tani, before just a little page about me, but we can go ahead and move past that. So your issues and rural issues are SORH issues. Your SORH is invested in improving rural health in many ways, through trainings in their states and through No SORH. They have, as Tani's mentioned, resources to a variety of areas for grants, both writing and providing, for health equity, maternal and child health issues, workforce issues, housing, food, transportation, and more. Again, it does depend on your SORH and your state and what the needs are there. They interact with many organizations and stakeholders that can be beneficial to you, that you should, and interact with, and can be your connection to these organizations. All SORH are also members of the NRHA. So they all have get that knowledge, and they're on those membership roles and get the education through there. And they're also through regional and national meetings from federal partners, from No SORH, NRA and NRHA. SORHs have access to best practices from all around all 50 states. So if there is something going on in your community, they usually will be able to hear about it. If they are not actively working on it, they would probably have a resource, knowing somebody to go through, or us as No SORH as an agency is also somebody they can reach out to make sure they get that connection if they're not able to answer their questions. So they also, as Tani mentioned, can help with recruiting or training your healthcare workforce through multiple ways of the federal programs, state programs, and retention efforts. While each SORH office houses different programs, they can be your connection to the state and federal loan repayment programs that can entice healthcare workers to rural areas. Many of them also maintain the Conrad J1 visa waivers. And they also work through graduate medical rural training programs through medical schools. They offer free trainings for rural healthcare workers that can give them CUEs and programs that encourage workers to stay in those rural areas. Like Tani mentioned before, through housing, workforce for their spouses, and schooling. How they do that through us? That is through a lot of the stuff they can get from our website. No SORH has resources for SORHs and all stakeholders in rural health. Some resources are restricted to just SORH members only, but many of the other resources that we have can be accessed through the nosorh.org website. All right, go ahead, Tani. Well, so the first thing on the website that might be resources for you that we encourage you to make contact, like we said, with your SORH, even if it's so you can stay informed on grants and resources they are aware of. On the homepage of the SORH website, you can browse members by state, by name, and get the contact information for your SORH. Your SORH has access to additional fact sheets and training modules that they can share with you, with your communities. Like they have fact sheets on the Flex grant, ACE scores, many different things that they can share with you. You will click a button for me, Tani. You can get the information on events involving SORH, including the National Rural EMS and Care Conference, which is open to rural EMS stakeholders from across the country. This is a yearly conference that is focused on rural emergency medical services. So we will have speakers from across the nation talking about behavioral health, retention, resources that are for the EMS. Many of the SORHs will also pay for rural EMS agencies to attend this conference for free. So something to keep an eye on. We do usually keep that, which if Connie, you'll click one more time on that page for me. You can view a lot of our past webinars, see institutes that we've had available, such as the Grant Writing Institute, past events that we did, such as the past EMS and care. You do need a passcode for some of the past paid conferences, but you would still be able to have access to it. You can see institutes that are open to stakeholders, such as the Grant Writing Institute, which we encourage communities to sign up for, SORHs to sign up for, anyone that will have access or need to write or maintain a grant. There's news involving grants and the programs that run those grants and much more. You can also sign up for the branch newsletter, which is a monthly update for SORH members and partners. You can see past issues on the website, kind of gives you a little updates on what's been going on. And then one of the big things that we're really proud of is we love promoting National Rural Health Day. National Rural Health Day is the third Thursday in November every year, and it showcases the efforts of rural healthcare providers, state offices of rural health, and other rural stakeholders to address the unique healthcare challenges that rural citizens face today and into the future. We look for innovational ideas, data points that you can share, and this is a great day to kind of highlight those issues. On the website of powerofrural.org, you can find media toolkits, key messages, data points, logos, and promotional items, including coloring books that you can print out for free to give to your patients and clients. You'll also find your industry category ideas for activities to promote and or celebrate National Rural Health Day. And it will go through, if it's just a rural stakeholder, if you are a healthcare provider, it goes for the SORH. So if you go through that page, you can usually find something that might be of interest to you and work for your agency. All right. And then additionally, your connection, SORHs are your connection to SHIP and Flex programs. As you know, Flex programs serve over 1,000 causes across the state. In states where applicable, your SORH also maintains that Flex and SHIP grant for your state. These programs offer education and trainings for critical access hospitals and some PPS hospitals. The Flex program aims to improve rural healthcare equity, financial health and hospital operations, emergency medical services, and health of people who live in those rural areas. And those four topic areas can give SORHs a little bit of leeway in helping you out and finding what will work in your community. Many have access to or have programs in place for all levels in your hospitals. from C-suite to support staff. With No SORH, SORH are actively also working on the state flex program reauthorization on Capitol Hill. Your SORH can also offer you resources if you are interested in learning more about the REH designations and that process. There is a federal designated TA organization for that, but we can also help with education for that for your communities and get you in contact with any resources that you would need for that process. SORH can also be your connection to rural health clinics and trainings and other resources for rural health clinics. As Tawny's mentioned, I know they just wrapped up a individual RHC institute that was giving TA and CEU credits to folks, going from billing data points all the way up. And while it was for individual RHCs, but any RHC was welcome to attend. So I am a fast talker, so but thank you for listening and joining us today. And let you know if you guys have any questions.
Excellent. Thank you, Caroline. We have time for questions. And I also wanted to note, so think of your question and go ahead and type it into the chat, or get ready to unmute yourself, raise your hand if you like, and I can unmute you. But I did drop a link to 3R State Network Coordinators, which Caroline mentioned earlier, and you can look for your state. And I will also, when we send out the recording, drop a link for you to register for the branch newsletter, as well as a link to the National Rural Health Day, which is in November. They have some great toolkits and stuff that you can share and use, so that you don't have to do that yourself. You can promote it without, putting the work to it, which is always nice. Okay, so let me check chat and just see what questions might be there.
Yeah, thanks for mentioning that, Cassidy. We do like to try to make things easy for both the SORHs and for anyone trying to use the resources. So as much as, because we know how busy everyone is in these spaces. So that was a really great point. A lot of the media kits, it's already typed up. You just have to input your state or your community in there.
Yeah,
Thank
absolutely.
you.
I mean, we've used it in the past and it's fantastic. I don't see any questions in the chat. So since we have time, I will just give you a few minutes. I know we had some people join after we got started, and just to remind you that we will share this slide deck as well as a copy of this recording within the next 48 hours after we finish up this webinar, just so we can get it posted and then send it out to you guys. And then we'll link to any resources that Caroline mentioned or Tawny mentioned that we can give you guys the quick hyperlinks to. So I'm going to check the chat one more time. I don't see any questions. I'd asked at the beginning if anyone was actively working with your SORH, or if you've partnered with them in the past. We would love to hear how. It might give some other states some ideas or topics or resources to suggest to their SORH. So we would welcome just a quick note about that if you like. I don't see anything coming in, so it's a quiet group today. That's okay. If you think of something once we end the presentation, please don't hesitate to reach out to either Tawny or Caroline or myself, and I would be happy to forward your question along or get you in contact with any of them, or make some connections with your state office of rural health if you're not engaged and would like to become engaged. So please don't hesitate to reach out to us for any of those things. And I think we will go ahead and give you back a good chunk of your time today. But we thank you for joining us, and we hope that you join us next month for our next webinar. Thank you, Caroline. Thank you, Tawny. We really appreciate it. You guys are a fantastic resource, and we're so glad to have you.
Thank you so much. Appreciate it. Have a great day, everyone.
Thank you for having us. Thank you.